Today on 21st Century Business, explore state-of-the-art technology, innovative business strategies, insights from cutting-edge corporations around the globe, a visionary look into the answers of tomorrow, today. Business leaders, business solutions, 21st Century Business.
Welcome to 21st Century Health. I'm Jackie Bales. The sports medicine and orthopedic industry has long been searching for a definitive solution for patients with tendinosis of the shoulder, elbow, knee, foot, or ankle, a painful injury of the tendon often caused by overuse. Until now, when conservative treatment failed, the only option was surgery. Finally, a new minimally invasive alternative is available, as we're about to hear from Juggy Gill, CEO and founder of Tenex Health. Welcome, Juggy.
Jackie, it's a pleasure to be here.
First of all, Juggy, what is tendinosis and what have the options been so far?
So tendinosis is a condition where people have pain in their joints because the tendon, which is the structure that joins the muscles to the bones, breaks down. And the tendon breaks down because of overuse, or it could be because of trauma from an injury. So that broken down tendon forms a scar within the belly of the tendon. That causes a fair amount of pain. It also limits the range of motion. So people that have tendinoses, your options are really when you have this pain for a period of weeks to months. During that time, you're advised to ice it, rest it, and take some over-the-counter pain medication. If that doesn't work, your option then is to get a cortisone injection delivered by your doctor. That's really not the ideal scenario because cortisone just masks the pain. And recent data suggests that cortisone actually starts to damage the tendon tissue. So it's not the ideal solution. So patients often suffer for months to a year, and if the conservative treatment, as we've just discussed, doesn't work, their only option is a surgical procedure where the physician will go in and in an open procedure under general anesthesia remove the damaged tendon tissue.
And then all the recovery time associated with that is pretty horrible also.
Precisely. So the burden then is on the cost of the procedure for an open surgical procedure, the long recovery time for the patient, and just the invasiveness and the secondary scar formation that can happen with this surgery.
So who is Tenex Health, Juggy, and what is this new minimally invasive procedure that you've developed?
So Tenex Health is a company that I founded in 2009, and it was a company that came out in collaboration with the Mayo Clinic in Rochester, Minnesota, and has developed technologies that really utilize ultrasound imaging to guide the procedures so that you can remove the tissue in a minimally invasive manner. What I mean by that is that the ultrasound that we use is typically the same ultrasound that you use to visualize babies in the womb. And in doing so, you can see the diseased tissue. And you can see the diseased tissue in comparison to healthy tissue. We have developed and we have patented technology that uses ultrasonic energy or high frequency energy, and it's delivered through a needle the size of a toothpick that can go in and break down the diseased tissue or bone spurs. And this is all done under local anesthesia. The patient's awake. This is all done within 10 to 12 minutes. The procedure itself is called the F.A.S.T procedure, and that's an acronym for Focused Aspiration of Soft Tissue.
Well, let's learn more about the F.A.S.T procedure and what it accomplishes in this 21st Century Health Field Report.
As a sports medicine physician here at Tenex Orthopedic Clinic, I have the privilege of working with Florida State University. And we were really excited about being able to use this. We like to stay on the cutting edge of all the different things that are developed. And we've already been able to use this with some of our athletes at Florida State, and are really excited about the improvement. I can see this expanding a lot in sports medicine because our goal is to get people better as quickly as we can with as minimal downtime as we can. And this looks like it's a great step in that direction.
There was no pain at all. I mean, you felt getting the shot, but it was just like I was getting a shot. And then after that, I could feel him pressing on me, but I couldn't feel, I couldn't tell what he was doing. I had no idea there was a needle in my elbow.
The new F.A.S.T procedure that has been developed is a simple outpatient surgery. And it's really nice because the patients feel almost nothing. I just finished one, and the only thing that they felt at all was the needle stick to numb up the area. They're totally awake the whole time. I talk to them as they're having the procedure, make sure that they're comfortable. We've had no issues while we're doing the procedure, and most people feel nothing. It's very quick. The actual procedure itself is way less than 15 minutes. That actually removes that bad tissue, and that accelerates healing. which to me is one of the great things about it, is it actually is fixing part of the problem, even more so than the traditional treatments. Following the procedure, there is very little that the patient has to worry about. Over the next several days, some of them have a little bit of pain, but not very much. Some of my patients have actually felt almost complete pain relief 2 or 3 days later. Some takes 2 to 4 weeks.
Juggy, what conditions can the F.A.S.T procedure address?
So since we've launched the product in the U.S. in September of 2011, we've treated almost 500 patients. And the conditions range from tennis elbow, golfer's elbow, when you have damage to the tendons associated with your outside or inside of your elbow, plantar fascia, which can be a very painful condition in the heel, Achilles tendinosis, patella tendinosis, which is a fancy word for jumper's knee, and then we have rotator cuff and shoulder injuries as well that we've been able to treat.
Wow. Can you elaborate a little more on how exactly this procedure is performed?
Certainly. The procedure is performed in an outpatient setting, so the patient literally walks in. The patient does not need to have any restrictions before the procedure, so there's no fasting of anything of that nature. We essentially clean the skin. We numb the skin with a needle, the needle about the size of what you get your flu shot with. And then the physician will visualize the diseased tissue, whether he needs to remove damaged tendon tissue or whether he needs to remove a bone spur. After he visualizes this, he then makes a nick in the skin, and then we insert our what's called the TX1 handpiece, which is our instrument. You can see this under ultrasound, and the physician navigates this to the diseased area. He presses a foot pedal that activates the energy, again, that we talked about, that specifically breaks down the targeted diseased tissue. That tissue is removed literally within 10 to 30 seconds. We apply then a Band-Aid. There is no stitch, there is no suture. We apply a Band-Aid to the patient, and then we tell the patient to typically rest the elbow or the foot or the knee for a period of about 1 to 2 weeks before they go back to moderate levels of activity.
Now, the needle itself and the diseased dead tissue, does that just disappear when it's broken up by the ultrasound waves, or does the needle take it out? What actually happens there?
Yeah, it's a great question. So what the needle does is it delivers a high level of frequency of ultrasonic energy. Think of it as the speed of sound. And what we have in our patents is we figured out the frequency that you need to deliver to break down diseased tendon tissue, which is different from healthy tendon tissue. We figured out the frequency that you need to deliver to break down bone spurs, which is different from the surrounding tissue. As it breaks it down, the needle also has a mechanism to suck out the tissue that you've broken down. So through the same instrument, we not only break down the diseased tissue, but we remove it through the same instrument. And by doing so then, what we've seen in patients is not only do we have pain relief quickly from the patients, and that pain relief is sustainable, but as we look at their elbows or their joints, through ultrasound down the road, we see a remodeling. And what I mean by that is that area of diseased tissue now, over a period of months, is replaced with healthy tissue. So what we're really trying to do is what they do surgically, which is remove the diseased tissue, really in a way to remove the pain that's being caused, and also to allow the body to heal itself.
Sounds absolutely amazing, to be honest with you. Now, why is the ultrasound imaging needed when doing the F.A.S.T procedure?
So as we talked about, the ultrasound allows you to visualize the targeted tissue you want to remove, whether it's tendon or bone. If you were to do this without any kind of imaging, you wouldn't know where you're placing the needle. So said another way, it allows the surgeon to see what he's doing without opening up the body. Ultrasound gives you a good image of bones and tendons, and it also gives you a very good image of diseased bone and tendon. So with that, you can see the difference between healthy and diseased tissue, and it allows you to navigate our technology, the TX1 handpiece, right into the defected area of the target tissue.
So, Jaggi, when exactly is the F.A.S.T procedure performed?
So as I said, we've treated over 500 patients, and in the overwhelming majority of these patients, they are treated either at the point where they're considering cortisone injections or before cortisone injections. So what we're seeing is patients don't want to wait months for treatment. They want to go back to their workplace, they want to regain their recreational activities, they want to go back to enjoying what they like to do.
Right.
So with that, because the safety profile and the level of invasiveness of this procedure is so minimal, our physicians and those patients are quickly adopting this early on in the progression of their disease.
Well, we're the instant gratification society,
That's
I
right.
suppose, so it only makes sense. So if a patient goes ahead and has this procedure, what should they expect?
When they have the procedure, we tell them usually when they go home that day is to ice it, and if they feel a little soreness, take some Tylenol. So they should take it easy for that day. Typically, within the next day, many of them return to work if they have a office-based work setting. What we often have them do is refrain from any moderate weight activity, so no weight-bearing activity. And we tell them to do that for about 1 to 2 weeks, at which point they come back to see their physician. During this entire time, never are we encouraging them to do physical therapy. So literally, it's the procedure is done, you go home, you ice it, you take it easy, and then you let the body do the rest of the work in terms of the healing of that diseased tendon.
So if there's no physical therapy and if you're just letting the body do its work, what do you expect then after the F.A.S.T procedure? What do you tell people?
We tell people that they may feel a little bit of soreness in the area that we treated, a dull aching pain for a couple of days. In our experience, there's been over 95% of the patients that we've treated with the F.A.S.T procedure have pain relief within a week. So that's a blessing as well as a challenge. The blessing is obviously we're able to deliver that pain relief. The challenge is because they feel better, we don't want them to getting back into full exertional activities that quickly. So we really tell them to take it easy for at least 2 weeks before they go back to any kind of moderate level of activities.
That's remarkable, though. It makes you feel so good you think you can do more than you actually can.
Precisely.
More than you should.
Precisely.
What would you say, Juggy? I mean, this sounds like a groundbreaking device to me. What is the most profound aspect of the F.A.S.T procedure?
I think there's 2 things that hit us. One is we are really, I think, replicating what's done surgically, but doing so in a minimally invasive manner. And I think in medicine we are on the front end of image-guided procedures. So we're using ultrasound as our image guiding. So we can see the inside of the body without making an incision or general surgery. So the profoundness is if you can reproduce what's intended to be done during an open surgical procedure, but doing it minimally invasively, that's good for the patient, it's good for the healthcare system, and it's certainly very good for the physician because they can treat more patients.
Sure.
On the flip side, I think the other thing that we feel particularly proud of is the experience from the patient. It's very well tolerated, it's a very quick return to activity procedure, and most importantly, it alleviates their pain in a very meaningful and a quick fashion.
So what's the most pleasant surprise for the patient then?
I think the most pleasant surprise is during the procedure there is no discomfort. The only discomfort that we have heard is during the numbing of the skin. Outside of that, they do not feel the Tenex probe or the TX1 probe going into the body and removing the tissue, but it's only that discomfort during numbing of the skin. And I think the other pleasant surprise for all of us is that quick return to activity and the quick pain relief.
And their reaction, what do they say?
Some have called it the magic wand. Some have said that this has been a game changer. Others have called it a life changer. And that's what makes us particularly proud, because from people that are using this as getting back to their vocation, improving their lifestyle from recreation, we've also had the opportunity to treat some athletes, some professional athletes, and that's obviously made an impact on their livelihood.
Definitely. Now, I know you worked in collaboration with the Mayo Clinic, so obviously there was a lot of testing going on, clearly. How quantifiable are the results of the F.A.S.T procedure?
So the Mayo Clinic was involved in the early development of this technology. Since that time, we have gone on and expanded the technology to a number of centers throughout the country. Some of the premier medical and sports medical centers in the country, such as the Andrews Institute in Florida, the Stedman Clinic in Vail, Colorado, the Mayo Clinic, as we mentioned, as well as the Kerlan Jobe Clinic in Los Angeles. And what we've seen through their experiences and many other of the centers in the country, again, we have patients that have had a 95% overall success rate within a week in terms of pain relief, and that's been sustainable up to 6 months and beyond as we've been tracking these patients. The other thing that's we feel very grateful for and very pleased at is the safety profile. What I mean by that is we haven't seen any complications to speak of that has required any physician intervention as we've done all these patients. So it seems to be a very well tolerated procedure, seems to be a very safe procedure, and as our data is coming out now, a very effective procedure.
And if I might ask, how does a patient go about getting this procedure? What do they call their doctor?
Right, so we are in the process now of launching this throughout the country. As we sit here and have this discussion, we have about 30 centers in the country. By the end of March of 2012, we'll have an additional 30 centers throughout the country of doctors that have been trained on how to do the F.A.S.T procedure. So the physician is obviously out there talking to their patients that would be candidates for this procedure. Patients themselves can go to our website, it's fastprocedure.com, and they can there learn a little bit more about the procedure, hear some testimonials of patients that have had the procedure done, as well as look for physicians in their area that they might go and reach out to for the procedure.
Juggy, where do you believe your industry's heading, and what role do you foresee your company, Tenex Health, playing?
I think the medical industry in general, specifically sports medicine, is headed towards a delivery of health systems that is cost-effective and also that is less invasive. I think if your system or whatever technology you might have doesn't have those two attributes to it, that's a challenge in terms of adoption in this marketplace. So I think medical technology specifically has to look at the cost of the procedure to the reimbursement and the insurance systems, and also the consumer or the patient aspect of this. How well tolerated is this procedure? And how quickly can people regain their activities? And it's those really facets that we were focused on as we were developing the company from the outset.
Well, it just seems like such an enormous leap forward in the treatment of such a common and painful condition. I mean, you talk about it being more effective, less invasive, and less costly. I don't know how it could be better. Thank you for sharing it with us.
Yeah, the pleasure was mine.
And thank you for watching. For 21st Century Health, I'm Jackie Bales.